My name is Armando Loredo. I'm 66 years old, and I'm from Murrieta, California. I have had heart issues for about 20 years, and that includes like angiograms. In 1990, I had a heart attack. After that, I eventually had a triple bypass in 1996. Before the bypass, I had difficulties exercising. I couldn't walk or jog. I've had angina, chest pains before and after the bypass, even before and after the stent. And actually after the bypass, I somewhat felt better. Somewhat temporarily though. That probably lasted for about a year. After the year, my understanding is that the bypasses and the stents are temporary. 2012, last year, I had a stent. At that time, I actually was not intending to do anything else as far as invasive tests or procedures, because I became to realize that all these procedures were temporary. I had never been told that before, that the bypass was good only for X number of years, or that the stent was good for X number of months or maybe years. But when I came to realize that, I made a decision that I would not do anything invasive anymore. Before I had my bypass, I had actually just gone in for an angiogram. But while I was there, I was told that if I didn't get the stent for one of my three problem arteries, that I probably wouldn't make it to the parking lot. I was laying there in the somewhat operating room, and it was an easy decision, I suppose, to just let him do it, because in an angiogram, you're already in there. But had I had more time to collect my thoughts, I would not have believed them. At the time, however, I didn't know about EECP. Had I known about EECP, I, of course, would not have proceeded with the stent. Every time you get one of those tests, unfortunately, the doctor never told me, but I had to go on the various internet sites to find out that there's at least a 2% risk, 2 out of 100 are going to die from those tests, and a larger percentage are going to die from the actual surgeries. A lot of my friends have died from these surgeries, bypasses. I almost died from a stent. They did 2 stents on me when I had that triple bypass, and they accidentally cut an artery, and so they had to proceed with a open heart surgery. So there are accidents that can happen. There's all kinds of things that can happen when you do invasive tests, when you do the various surgeries. And the great thing about EECP is that it's not invasive, it's not a surgery, and so you've got nothing to lose, but a lot to gain. The artery started to get clogged up again. I was somewhat warned that if I refused to have any further procedures, that I probably, that I could have a heart attack any time. And knowing that, I started to follow a daily routine, somewhat based on not knowing whether today would be my last day. I felt that I probably could last perhaps a year, but since heart attacks can strike you at any time, I just had to prepare myself for the final outcome. Now, my wife was aware of it. She, of course, was disappointed, that her lifelong partner, we've been married for 43 years, would not last as long as we had planned. I heard about Global Cardio Care by Googling on the internet, and I was lucky to find the Sarah Salati Health for Life program. I wanted global because I was impressed with the educational program that they had in addition to the treatment. I wanted the treatment as well as the education so that it would be more successful. When I first came to Global Cardio, I had angina, I had chest pains, and the level of intensity was serious. I've had chest pains over the years, and there are times that they were somewhat mild. But right before I came to Global, I realized that I was getting worse. The intensity level was getting higher. I've been dealing with cardiologists and their staff for at least 20 years. And here, it feels like a family, whether it's the technicians, whether it's the nurses, the doctors. When I come here, I come here with a smile. I look around, and not just staff, but the patients, everybody's feeling good. That makes me feel better, helps me to get better. And so I'm very happy that I selected Global Cardio for my treatment. And I feel a lot better than I did when I started. And I'm very, very hopeful and feel very good that there is a better future for me. My symptoms, they started to lessen after about 10 treatments. And I started feeling I had more energy. My chest pains were less frequent. I would be having them daily before I started. I was feeling less pain, so that would then give me the energy to do more exercises. I've asked my doctors, I asked a recent cardiologist about it, and pretty much the ones I've asked at least, they dissuade me from EECP. And to me, it almost sounds as if they're not aware of it, or it makes me wonder if they are aware of it, why they try to dissuade at least me from pursuing it. Against their opinion, I proceeded because it is my body, and so I had to make a decision as to what is best for myself. I realized that with this treatment, I would not have needed all those surgeries and all those invasive tests that I undertook over the last 12 years, which made me feel really stupid. Anyone who has serious heart issues, blockages, chest pains, and it's been my experience that the only recommendation they're going to give you is to get more invasive tests and more invasive procedures, which of course are temporary. I would recommend to others that they stop listening to the so-called experts and actually do your own research. My outlook in life is more hopeful as a result of my completion of my 35 sessions here at Global Cardio Care. In addition to feeling better, I'm able to appreciate life more so. Unfortunately, for a relative of mine who died about the time I started my EECP treatments, that made it possible for me to be in the same vicinity. And so I attended the wake. I made a call to Global Cardio to see if they could squeeze me in that day, because otherwise I'd be going back home about 100 miles away. And they were able to squeeze me in. So instead of attending the funeral, I chose to go cardio to get my first treatment. That was the start of my life-saving treatments and a longer future. I believe that global cardio care has saved my life. I believe that it will assure me many more years of a healthy heart. So I'm definitely a believer. A lot of my friends, some relatives, would still be alive if they had this treatment. I feel bad that I didn't learn about this treatment earlier so that I could have helped them. And that includes one brother, younger than me. He should have lived longer than me. And some of my childhood friends we went to school together. They could have been helped by this. They could have still been around. A lot of coworkers, a lot of neighbors that I've lost over the years. I had a neighbor who had a heart attack the same day I had a heart attack in 1990. It's just so many people, so many people. I myself am lucky to still be alive to be getting this treatment. The things that I had given up on, my music collection, that took me years to collect, things that I appreciated, but now I'm able to enjoy life. With the expectation that I'm going to live longer, I'm able to make plans with my family. I'm able to look around and see how I can be more of an asset. Before I had limited expectations. Now that my expectations are unlimited, I believe that in addition to telling my friends and relatives and anyone else about the benefits of EECP, I want to be able to give back to to my family and to others because of this positive attitude that I now have. The Sarah Salati Health for Life program has really saved my life. My name is Armando Loredo. I'm 66 years old, and I'm from Marietta, California. I'd like to thank Sarah Salati and the rest of the staff, especially Mark Rivera, who without his coordination, I would not have even been able to get scheduled to start as quickly as I did.